Welcome back to my channel, Health Tips 23, where the focus is on health and nothing but health. Today we want to look at some minor disorders in pregnancy. Also, some danger signs in pregnancy. Alright, let's first look at the minors. Alright, some minor disorders in pregnancy are like nausea and vomiting, morning sickness. Usually morning sickness comes with like a little nauseation, a little vomiting, and things like that. Alright. Another minor disorder is like food cravings, where the mother crave for food, like sometimes like salty food, sometimes like dirt. They like to eat the clay, the ashes, like the Jamaican setting where we cook on the wood fire. So the mom would walk and search for the hash to make sure that she put it in something and have it to well, I don't know if it's she snacks on it or what, but I know she eats it and enjoy it. Because to she, it's tasting good. Yes, but with the food craving, if she's craving for food that are nutritious, then that's not a problem, because of course that will be beneficial to both she and her baby. But like for the clay, the dirt, then there are health risks associated with this, because for the with the dirt, you can have parasites in the dirt, and then she eating the dirt, then it would affect her. Also, there are, like in some areas, where the dirt is contaminated with like some chemicals. For instance, like one common one is lead. Then she can get lead poisoning, and that can affect both she and her baby. Yeah, so that's it for food craving. All right, another one is varicosity, where the varicose veins, swellings of the veins, and it can be the leg, it can also be the genital area. Yes, the way the veins are getting large and so on. They can have leg cramps, leg pains, and that would be associated with the growing fetus, the growing baby, putting pressure on those veins, and then it can cause it. Also, they can have hemorrhoids, and again can be due to hormonal changes, because having to do with the peristaltic movement of the anus, the gut and the hole, which cause delay in emptying of the feces. So constipation can come in. Most times when the mothers are taking like iron supplement, sometimes too they tend to, that can help um escalate the constipation. Yeah, but not saying this to say that a mother must not take her iron. It's very important to take her iron supplement. But that can be corrected with like increasing of vegetables, increasing of fruits, intake of fruits, more water, and things like those. And we normally encourage a mother if she feels like if she goes to to pass her stool and she experiences difficulty in passing the stool, do not strain to pass the stool. Instead, just try to increase your fluid intake, your fruits, and like prune, you could get the prune and eat the prune. Reason being, if she strain to pass her stool, then it can be that it could be that she could have a rupture of membrane because straining down can cause pressure of the it's like when a mother is in labor and her baby is being delivered, then that is how normally the midwife normally said strain down like you want to do, and then so she can expel, she can rupture the membrane while straining to pass her stool, and the uterus, the fetus can be expelled. So we discourage a mother from straining to pass her stool. Just give it some time, increase your fluids, top it up with your fruits and your vegetables, and just relax. And then after a while, you will gradually have a bowel action. Okay. Another thing is heartburn. Yeah, you have stomach burn, and this is due to some hormonal changes that will cause that. So we normally like antacids. We normally, all right, for the where the heartburn, I always tell them drink milk, because if you like drink some milk, then it is like it's soothing to the stomach, and it will gradually go away. Eating your meals in small amount instead of eating a lot one time. Small amount, things like crackers and things like those, you're gonna munch on it, and those will help. And when you're eating, do not just eat and then lie down, because most times the heartburn is caused by the growing fetus, which pushes up the stomach and have the stomach up there instead of down. So the food that you eat, the digestion is being delayed. So we encourage you to, after a meal, just try to sit up instead of lying down at the same time. Right. And like I said, small, frequent meals instead of eating a lot one time. All right. We have things like chloasma. That's a skin disorder. And it's due to hormonal changes. And with the chloasma, is like little patches, discolored patches on the skin. But one place that it commonly affects is the face. Yes, but this is something that usually goes away after birth. Yeah, it normally goes away. So nothing much to worry about. Just hope for the time comes where, yes, delivery goes on and the baby is out, and then that too will pass. Sometimes the mother might experience joint pains and like leg cramps. Well, those are really some hormonal changes, and with the weight of the baby growing while growing. Yes. That's basically it in a nutshell. All right, we now look at some danger signs in pregnancies. All right, danger signs mean if you see any of these things occurring while you're pregnant, then you have to seek medical assistance. All right, one, we look at things like PV bleeding, like pervaginal bleeding vaginally. Because once you are pregnant, then the only time when you are expecting to see some bleeding or should see some signs of bleeding is when you are ready to have your baby. Other than that, it is danger. All right. Like passing a lot of water or passing water vaginally. Yes, it's a danger sign because this could be a premature rupture of the membrane. And with a premature rupture of the membrane, then you can lose your baby because the life of the child is now at risk once the membrane is ruptured. Right. Things like vaginal discharge, like an unusual vaginal discharge, where it might be heavier, might be like, and depending on the color, it might be yellowish. Different vaginal infections shows different signs if there's a vaginal discharge that is associated with the infection. So if it's heavy, say yellowish, or sometimes frothy, offensive, sometimes it might be offensive, sometimes not, itching, then or burning, then you have to see a doctor, because there are some vaginal infections that can pass the placenta barrier and affects the growing baby inside of you. So we don't advise to see a doctor if those things occur. Also, if a mother is pregnant and notice she has a temperature, say a fever, say a temperature like say 100 or more, then it's evident that some infection might be going on inside of her. So you don't want to run that risk of staying home. You need to see a doctor. You must see your health provider, which is, well, not just a doctor, but an obstetrician, gynecologist, OBGYN. Right. It's obstetrician and gynecologist. Right. So at the same breath, not trying to say anything bad about you pregnant and just going to a doctor. But you need to know who you go to seek care for your baby that is growing inside of you and yourself. Because it is not a matter of looking after the baby, but you're going to look after yourself and the baby. Okay. All right. You have another danger sign that we want to look at is like, say, headache. If you notice you're having severe headache and it lasts for a long time, then that is something for you to see the doctor about, because it could be that you're having your blood pressure is high, and with the blood pressure, if the blood pressure is high, you're having chest pains, you're having blur vision where you're seeing some mini, then, and sometimes vomiting as well. These are sometimes some symptoms of high blood pressure. And with this you can have and one thing I forgot, the swelling of the feet, the hands, and the abdomen as well, because there's a condition that is called preeclampsia. And with preeclampsia, you have some cardiac signs that you look for. One, you can have headache, chest pain, blur vision, edema, which is one of the common one, like the ankle. Sometimes that's the commonest one that is that the mother experience. Also, you can have edema of the abdomen. Sometimes the mom is pregnant, and when you look at the tummy, you could see the pitting where if she wears a skirt or a pants where with where they are wearing a belt, something like a belt or something like that, then it can leave a mark on the abdomen, which is quite obvious looking at it. So with those signs, I would urge you to see your healthcare provider. And because when you go, another one, what you might not be able to see is if there is protein in the urine, because that is also associated with the signs of preeclampsia. And is the healthcare provider that is going to do a dipstick, urinary dipstick, use a dipstick to test the urine to see if it has any protein in the urine. And it also helps to detect ketones. Yes, and the ketones is like, say, excessive vomiting or something like that. Then where dehydration might be taking place. Then ketones is evident in the urine. Right. Another danger sign in pregnancy is I would say like severe did I say severe abdominal pain? Yes, severe abdominal pain is another sign, danger sign, that if that occur, then you'd have to see that as something urgent. All right. If you have excessive vomiting, where, well, the morning sickness can sometimes lead up to this. Excessive vomiting, where you're unable to keep down anything for the day, whether it be food or fluid, then this is something that you need to take seriously, because there's this condition, hyperemesis gravidarum, where it's a disorder in pregnancy where with excessive vomiting, and with this the mom can be easily dehydrated, because and she can she can go short of nutrients and so on, because she's vomiting, then she's afraid of eating, and then with this it can her condition can be deteriorated like quick. So we encourage you, if you see you having a pregnant mother and you're having 2 to 3 times vomiting, heavy vomiting per day, then you need to see a doctor, because they will do the check you to find out what the body is lacking, and then they will treat it. And like I said, with excessive vomiting, you have to be careful, because this can cause you to go into premature labor, which is not something you would want to happen, right? So you'd have to see your doctor in that case, because admission in most cases, most of the time, admission is warranted in this. And the mother is has to get IV fluids and some medication like antihistamines also that will help to keep down the vomiting or to prevent it. So it's important to see the doctor where that is concerned. Yeah, I think that's it. In a nutshell, that's it in a nutshell. So until next time, thank you for watching, and as usual, please like, share, and subscribe to my channel, so that as soon as I'm out with a next video, then you will be able to see it. Thank you.